Okay, let's start over. We're just about to do the procedure here on Peter, who's come from Sweden. He's just taking a little drink of a little bit of a painkiller right now because he has a tough time swallowing pills, so we're not going to give him pills, so that'll work. And then he's going to have some sedatives that he's going to take, and they'll take effect in a little while, but it'll take a little while. So we're going to get the injection, and then we're ready to go. Let's see what you can and can't do. Now, the first thing that we want to notice with him, this has only been 4 months. 4 months, right?
4.5 months.
This has only been 4 months. So if we look at his shoulders, you can clearly see, this is Peter from Sweden, you can clearly see that the right shoulder has significantly atrophied. So this is a pretty bad adhesive capsulitis. When it atrophies this fast, it's not a great sign. You know, he's got almost nothing left here on the middle deltoid. It's right down to the bone. If we look at the other deltoid from this angle here, you can see a nice rounding, a nice fullness of the muscle. And this one, it's just completely flat. You're just literally seeing the head of the bone here. This one, you can't really see that. So this is a lot of atrophy for such a short term for this kind of adhesive capsulitis, which I would say makes it a more significant or serious case than some of the other ones. Whenever it deteriorates that fast, that's not a good thing. And that usually also means that it's going to last a lot longer. So his might have been in the realm of, 3 years rather than 1.5 or 2 years. And not only that, he might have been in one of the cases where he doesn't recover, because 1 out of 15 patients never recover, which is something that a lot of doctors don't even know, but that's in fact what the statistics show. This is the true range of motion of his glenohumeral joint, just so you have it on camera. This is the good one. This is the actual true range. That's it. It actually doesn't go higher than that. If I hold the humerus in the same way that I'm holding the humerus on the other side, that's the glenohumeral motion. This is also the external rotation. This is before here. This is how far this arm goes. That's how far this one goes. That's it. No more. He doesn't go any more than that. So it's pretty severe frozen shoulder. If I move his arm this way, when I do this arm, I can actually move it without moving the whole body. I can rotate the arm without moving the body because there's motion in this joint. If I rotate this joint, his whole shoulder will just go way forward. He has a typical situation, but even worse than a lot of cases, where he's got a complete reversal of the normal neck curvature, causing the weight of the head to be imposed upon the central gibosity of the opposite curve. So structurally, he's completely opposite to normal. He's got about 50% loss of the normal disc space at C5-6, which is exactly the level of the nerves that go into the shoulder muscles. So this is one of the predisposing factors of adhesive capsulitis frozen shoulder, in conjunction with the hormone imbalances and some type of tear injury or stress injury. It can, even if it's seemingly insignificant, to the muscles that are supplied by those nerve roots C5-6. So he needs to get the shoulder, he needs to get the neck fixed when he goes back to Sweden. If he doesn't get the neck fixed, he's probably going to be one of the 35% that gets it in the other shoulder as well. Now, so we're going to mark on here what we've just found. This is latissimus dorsi short, which is red. Infraspinatus obviously is short. The subscapularis is short and weak. Blue is weak. So we're just going to put a little circle around there. The long head of the biceps is very weak as well. And the middle deltoid is weak. So that's what the chart looks like for him. And at C5-6, we're going to have some problems. Let's take a look at this reverse curve. We'll mark it on here. Just a forward head carriage with a reverse curve in his neck there. So we know we've got a C5-6 degenerative disc disease in that area. Nice. You can see the depression in here as opposed to the other side. So there is atrophy in through here as well on that shoulder. Noise, it's not going to hurt, okay? There you go. Perfect. Just relax. Now, wash your head back with the palm of your hand back and forth. Move it yourself. Do it yourself. So he needs to be moving and rotating his shoulder, washing his head, top of his head. Okay, it's one of his exercises.
Is it better?
What?
Is it little better?
Yeah, much better.
What do you mean a little better? It's a lot better.
A lot better.
Look, do you see? Do you even know where your arm is right now? You can't even see your arm. Look.
Wow. It's down there. It's down.
Hard to believe, eh?
Should I raise it up?
Mm-hmm. Go ahead.
Oh.
Okay, back again. Okay, both hands up like this. Go ahead. Wow, it's going even faster now, eh? Look at that. Even faster.
There we go. Yeah.
Faster and faster. Straighten the elbows. Good for you. Huh? Amazing, huh? Straighten it. Good. It's going back even, yeah.
It's great.
Yeah? Good. It was worth it, eh?
Yeah,
all that?
It's worth all the
worth
trouble
it,
we have had.
all the trouble, right?
Everything all around.
Okay. All right. Well, you make sure you go back to all those doctors and everybody that said that it wouldn't work, and you tell them about it, right? You're going to do that? You promise?
I will do it.
You go back, go, hi, look what I did. You didn't listen to you. Okay, now go and do the push-up again. Come on. Do it. Keep the hands there. All the way down. Let everything rest. Let it rest. Let it rest. Let it rest. Let it rest. Now push it up. Come on. There you go. And back. You do about 2 or 3 of these. 2 or 3 of each exercise every hour. Only 2 or 3. That's all you need to do.
Yeah. Okay.
You don't need to do more. It's all about movement. That's all. And a little bit of muscle training.
Yeah.
That's it. When he does it down this way smoothly, he'll be able to also start to move it up as well.
Yeah.
Eccentric contraction before concentric contraction. Okay, go ahead. Good for you. Good for you. Keep it there. And push it up. Go ahead. Last one. Good. Come on, come on, come on. You do it yourself. That's good. Okay, good. Now. So here we are. This is it. We're finished. I know that Peter took him a long time to get here, and he wasn't too sure, and there was a lot of skepticism, a lot of people saying it wouldn't work, but did it work?
It did work very great.
Okay. All right. This is Dr. O and the Dr. O Show with another Trigenics success story.